So our next speaker is Elizabeth Weybright. She is an associate professor in prevention science and is on sabbatical this year, but has graciously decided to come and travel all the way up from San Diego to talk to us today. And she's going to talk about firearm engagement in rural Washington youth. And it's a project that I'm sort of tangentially involved in, and happy to hear your talk.
Great. Thanks. I'm happy to be here. I'm a faculty in the Human Development Department, and we have a graduate program in prevention science. And so that's kind of the lens in which I see any given health outcome of interest, whether it's substance use, in this case, firearm injury prevention, but really focusing in on that outcome and looking at risk and protective factors for it, and then developing interventions. So today I'm going to talk to you about give you a little bit of background, but talk to you about a project of where we're looking at firearm engagement among rural youth, and then we'll hone it into Washington State youth and let you know what we found. And spoiler, the call really is for community-based firearm prevention and harm reduction efforts. So I'll give that to you at the beginning. So a main take-home point, if you weren't aware already, is that firearms are the leading cause of death in childhood and adolescence. There was a paper that came out in the New England Journal of Medicine last year that found that firearm-related injuries had surpassed motor vehicle accidents to now become the leading cause of death in children and adolescents. And not only that, and I have to refer back to my notes for some of the details, but the rate of increase in that was 30%, which is more than twice as high than the relative increase in the general population. So not only now are firearms a leading cause of death, but that's happening at a higher rate than we see in other developmental stages. So what's the bigger picture going on? And I really love this continuing to talk about this specificity of the context and what's happening. So I'm going to kind of work backwards here. So we think of an outcome, we have firearm-related injury or death. If we go back from that, we know that firearm handgun carrying is often very closely tied to firearm injury. Access to a firearms, that's going to be an important piece. And then norms, descriptive, injunctive norms. So what do you think people are doing around you? And what do you perceive as acceptable or appropriate among your friends, among your family, among your community? I'm going to use these areas to kind of give you some more information, not only a background on rural adolescents, but also related to the projects and some of our findings thus far. So, how are rural youth different from urban youth? And so I will say this isn't a fine-grained comparison of rural. That is one of the things we've talked about doing down the line, but this is just data or study findings on rural versus urban. So let's start on the far right, injury or related death. Actually, the overall mortality rates are not significantly different between urban and rural environments. But when you start looking at the specifics, you do see some key differences. That for rural adolescents, the homicide rate is about 2 times lower, or if you say it conversely, for urban adolescents, the rate of firearm-related injury due to homicide is 2 times higher. And then the rate of firearm-related suicide is 2 times higher for rural adolescents. So you see this distinction when you start to do this rural-urban comparison of the mortality rate. So let's dive into carrying. So there is a greater prevalence of handgun carrying for adolescents. Again, I mentioned we know that carrying is a key kind of precursor to gun violence, this handgun or firearm carrying behavior. So adolescents in rural versus urban environments report higher level of handgun carrying, and the rate over time in which they're carrying is steeper. So we're seeing a sharper increase of handgun carrying for rural adolescents versus urban. So what about access? Almost 50% of rural individuals have a firearm in the home. That's only about a fifth, it's actually 19% of urban individuals. So there are more firearms within rural communities. This is an important correlate or a factor that's associated with, especially when we look at death by suicide in rural communities. If you look at death by suicide unrelated to firearms, there aren't major difference in rural and urban communities, but when you include death by suicide using a firearm, we can see that that is higher in rural versus urban. So again, there are some of these key differences when we start to hone in. And what about norms? What do adolescents feel their friends are doing? What do they perceive as acceptable or appropriate among their friend group, again, among their community, family, etc.? There actually are some similar peer norms, but I think what's missing in the literature, at least that I would argue, is this greater understanding of the rural context. There's this really interesting article, I want to make sure I get you the title right, called Growing Up in Rural America. And it talks about the importance of the natural environment and how this is often key to the identity for rural individuals and communities. And so if the natural environment looks different, the built environment in rural areas is going to look different than urban, right? We have longer roads. Sometimes we don't have sidewalks. We have things are farther spaced out. So by default, these different environments are going to be interacting with them in a different way. So that the typical acceptable behavior related to firearms is likely different in urban versus rural contexts. And this, when we get to the need for specificity, the cultural context of firearms for rural adolescents is the focus of this current project. So we really just want to understand what is happening in rural environments, because most of the literature that we've seen comes from urban environments when you look at firearms. So here's kind of the big piece. Few community-level firearm injury prevention efforts focus on rural adolescents. I'll repeat it just one more time. So few community-level firearm injury prevention efforts focus on rural adolescents. We have a lot of firearm injury prevention efforts. Some of them are violence disruptor, or efforts to interrupt the violence within the environment in which they're going to occur, often in urban areas. Some are supporting victims within an emergency department, within a healthcare provider. Some are screening for exposure to violence. These are interventions that currently exist, but oftentimes they're not happening within rural communities. Others are providing safe education about safe storage. So this was kind of the main focus of the overall project I'm going to share. So I'm working with a team. It's led by University of Washington researcher, Dr. Ali Rohani, with the Department of Epidemiology. Dr. Graves is a part of the advisory board for this project, and it's funded by the Centers for Disease Control. We're wrapping up year 3, which is pretty exciting. So there's a couple pieces of this project. One is taking data that has been collected on a group of individuals, youth who lived in rural communities from kindergarten, so when they were 5 years old, and they're now 28. They're actually wrapping up their their 28, it's not wave 28, but age 28 data collection. So it's this longitudinal study of these individuals since they were in kindergarten. But the other piece of this is this, what we're calling Youth Experiences in Rural Washington Research on Firearm Safety. So it's a brand new collection of data from rural adolescents within Washington state to really understand the cultural context of firearms. What does it look like in rural areas? How are you engaging with them? What does it look like within your family, within your community, within your peer group, et cetera? So I'm going to give you some findings from the broader study using that longitudinal data, which are these 4 findings. And then I'm going to give you some quotes that we have from the new data collection we have, which is mixed methods. So what's one of the key things we're learning about rural adolescents? 1, there are distinct patterns of handgun carrying across adolescence and young adulthood. So the study that's cited at the bottom found 6 longitudinal trajectories, and I'll give you a couple examples of what those look like or sound like. One is a trajectory of those who have never or have a really low probability of carrying. And this applied to about 80% of the group. There were 2 trajectories that were really, I would say, developmentally specific. So one was focused on adolescence, another was within emerging adulthood or young adulthood, where individuals were carrying within those developmental stages and not in others. So once we have these patterns, then we can start to see how are these patterns associated with other things, which is what we did in the next study. So we did find that these patterns of handgun carrying are associated with other risk behaviors. In this case, handgun carrying, depending on the pattern, really seemed to occur in tandem with other correlates of firearm-related violence, including the use or experience of bullying and physical violence. So we're seeing some of these associations in rural adolescents that we have seen in urban. We know that carrying to school is not common, but doing so is associated with risk factors for violence. Despite what you hear in the news and the headlines, this is not a common occurrence where adolescents are carrying firearms to school. And I'll give you an example of what the study found. Out of about 2,000 individuals, only 3% of the sample ever carried a firearm to school. Those who did carry to school, however, were more often reported violence risk factors at multiple contextual levels: individual, peer, community, etc. And we have a fourth study, which I'm really excited about. The publication is actually coming out later this week, which showed that a community-based prevention program, and this is a program that just targets a general prevention, often substance use prevention, but targets shared risk and protective factors, reduced handgun carrying at a later date. So here we have an earlier intervention than those interventions I talked about earlier: the violence disruptor, the education, intervening in the emergency department, et cetera. Earlier community-based prevention programs work. So what are we learning about rural Washington state adolescents? So we collected data from 93 rural adolescents within the state of Washington, and you can see the map over there. We had about 56% of the counties covered. These are adolescents who are currently enrolled in Washington State University's 4-H Youth Development Program, and half of them are in a shooting sports program, and then half of them are not in shooting sports. So within 4-H, they have a shooting sports option. They are not all shooting firearms, so there is archery, but they receive particular training around how to handle whatever particular shooting sport they're engaging with. We've collected this data and are still analyzing it, so I just want to give you some quotes. We collected a survey as well as did interviews and focus groups. So for example, when we're looking at norms, here's a quote from one of the adolescents about firearms. There's a lot of farms out where I live, so people in my community carry firearms for animals attacking other animals, for having to put down an animal that may be sick or broke its leg, or something like that. So they're talking about why people in their community carry firearms. What does it look like within their community? What about access? The people my age get firearms from their parents as a gift, or they get handed down from other relatives. So how are we obtaining firearms? How are rural adolescents obtaining firearms? And what about carrying? Here's an example from one adolescent. This was a female. She carried a handgun to go hiking. It was my mom and I. We went and she carried one and I carried one in case we got separated or something. So the thing I appreciate about these quotes is that you can see the rural context emerging, right? You can see that natural environment coming out. In the first one, we have attacking animals who are attacking animals, animals attacking me, potentially something like that. An animal is injured. We have the passing down of firearms from generation to generation. And then we have going out and hiking, assumingly in a rural setting, or I assume it's not urban hiking. So I just wanted to leave you with some of those quotes. So how do we move forward? So this is kind of my, what would next steps be, call to action. And I have 4 main takeaways. From a prevention science perspective, I always want to start with what works. What do we know is already effective? The Society for Adolescent Health and Medicine a couple of years ago put out, in the references below, they put out position statements and recommendations for preventing youth firearm violence. These mostly focused in clinical settings, but they did have one particularly that called out the need for community level strategies. So they called out so I think starting with the foundation of what do we know works. I'm going to talk about how we might want to tailor that in a moment. While we're looking at what works, we can intervene earlier than maybe we have been before. I mentioned that those community level prevention approaches, they work for firearm carrying later in life. So as we're seeing, there are some shared risk and protective factors that may be the same across rural and urban environments that we can be targeting. So implementing evidence-based interventions within the community will likely be effective. Now, it doesn't mean they shouldn't potentially be tailored. Maybe we should be tailoring them for a rural environment, or maybe we should be taking interventions that are already delivered in a rural setting and adapting them to add in firearm injury prevention approaches. One of the key pieces and the reason that I really appreciate the opportunity to work with youth is allowing for youth engagement and youth voice. And it's been really critical in this project, and I'll give you an example. One of the questions we asked in a survey, and we spent a lot of time talking about terminology. What does firearm mean? I've used the word carrying throughout. What does carrying mean? What does handling mean? So there is a federal definition of firearm. There is a general definition. We measure carrying a lot, but we don't often ask the people we're measuring it from what they think it means. And so we ask them, can you define these words for me for each of those terms, firearm, carrying, and handling? And they don't exactly match up what I think researchers think they mean. And that's an important piece, because if we're not starting from the same foundation, we're not talking the same language, it's going to be an issue later on. We also know that engaging youth in the process of intervention development can improve the effectiveness, it can improve the feasibility, it can improve the sustainability of a program, because we're tailoring it for them with their voices. And the fourth is meeting folks where they are. So this picture looks like it's of a barn with a bunch of hay. It's actually the site of one of the focus groups we held. We held it in a barn with a bunch of hay. And we gathered youth around to talk about firearms and to have this discussion about what it looks like where they are in their community. This actually occurred just north of Spokane on a place where I think they have buffalo too. I can't remember the name off the top of my head, but someone shared some pictures of buffalo or bison as well. So it may mean literally going to them, hearing from them, engaging with them, engaging with those practitioners who engage with youth, who are trusted sources of information. But I think it, more than literally, it also means understanding and acknowledging the role firearms play for individuals, families, and rural communities as a whole. A lot of the youth we talked to shared how important it was to be safe and respectful of firearms. And I think that's a wonderful foundation to start with, to talk about how to continue to engage with firearms safely as they may be present within rural communities within the home. I think that might be it. So I'm happy to answer follow-up questions and appreciate your time and attention.
I don't know how we want to handle questions. So go ahead, ask questions.
So my question's about firearms.
It was about 100 years ago that I grew up rural, and there were always firearms in the home. They were long guns, though.
Mm-hmm. Yeah.
And they were there for the reasons you talked about. You needed to keep coyotes, feral dogs off the sheep, and we hunted. Safety was a huge, important feature of having firearms in our home. We all had our gun safety training.
Mm-hmm.
So I was interested in a lot of what you know, are finding in these groups that presented reflected my experience. I was interested in whether you found a difference between in the 4-H programs and you didn't.
Yeah.
Because 4-H was a big part of my life as well. And there are a lot of programs that are cooperatives that and yet part of the rural culture, including fire.
Yeah, thanks for the question. You know, we did a focus group on the Colville Reservation, and the colleague who is the extension director for the reservation said, "Why are you asking these questions? Like, we deal with this all the time. This is a part of our lives. Why are you interested in this?" And I said, "Well, because from a research perspective, we don't know that. I mean, you know, because you live it, and anecdotally we may know that, but people aren't publishing about the lived experiences of real individuals and how they engage with firearms. So when I come and talk to some real person and they say, oh yeah, I took my shotgun for show and tell at school growing up, you get these stories and they start to emerge. So 4-H shooting sports does have a particular training, and I'm not going to be able to talk to you accurately about all of the details of what that looks like, but it is one of multiple trainings that you can receive. So absolutely, there are trainings. We saw on average that youth had, and oh, you asked about long gun versus handgun, and I'll come back to that in a minute. We saw youth on average the first time they engaged with a firearm was about 10, almost 11 years old, but that ranged. And so we saw much younger than that the first time they used a firearm. We also asked about long guns. I think that was less, when we're comparing to urban environments, a lot of that is on handguns. And so that's the main comparison, but we do see about 60% of the individuals have used a long gun as well. And so those were often mentioned for hunting and other purposes, absolutely, yes.
So I've done a lot of reading and listening to podcasts about sexual assault prevention on campuses, and they have these programs like Blue Light and other thing. In the research you did, was there a strong difference in rates compared with women who lived on campuses with programs than without?
So a lot of those programs are more so a feel-good thing than actually evidence-based. And I will say, in terms of sexual violence prevention, everything that's evidence-based happens before or in middle school. There is nothing yet that is evidence-based in the context of college intervention. And we also see, if you think of like bystander intervention programs, that there's no fidelity to the program. So it starts at, oh, it's going to be 8 hours and there's going to be check back, things that, that long-term intervention, like things like this work better. And it gets boiled down to, it's 1 hour during welcome week when you don't know where you live, you have no friends, like you're completely freaked out. And we think that 1 hour is going to be effective. So I'm sorry to kind of be breaking your your illusions about how well those programs work. Yeah.
I have a question for both of you, so I'll start here. It's a little bit similar, but you mentioned, campuses or areas that might not have as much access to like reporting measures or safety measures, that sort of thing. Do you find that from a what am I trying to say? From an attacker's perspective, is it more like preventative to have safety measures and the like fear of being caught, or do you find that it's more of like a cultural and social norm or social cultural conversation that would be more preventative than, say, the ability for a victim to report?
So we don't know, right? The right answer is we don't have a good answer to this, but it did seem that and Pullman might be a little bit of an exception. So I probably should not have noted Pullman because Pullman is ATVP, and I think the university can infuse resources in Pullman. But if you think of those other like small towns, but that don't have that much programming, it does seem like a big hole in comparison to those urban, metropolitan area, which we know have a lot of those intervention programs, and still the violence happens. This is kind of a best educated guess at that point. There is research on if being arrested for domestic violence works, and if it's imposed to be arrested, and the research is not super in favor of criminal justice intervention as being interventions that actually work. The norms, working on the norms and what's acceptable, what's not acceptable, when will people intervene, things like this might actually be more promising.
And now I think I was so engaged that I've lost the gist of the question. So I apologize if you want me to answer it.
I actually have a separate question for
Oh,
you.
okay. I was like, oh no.
My question for you is, you mentioned risk factors for violence and rural youth. Can you speak to what that means? Like, for what are the risk factors for those populations?
Yeah, so there's a number of them. I had noted, let me go back to my notes because I came prepared for people that ask follow-up questions. So for example, in the study that looked at caring to school, so there are some kind of known risk factors for firearm related violence. And so at an individual level, if you've been suspended, if you've engaged in the justice system, if you've been arrested, at the peer level, we know that what your close friends do are often things that you tend to do. So behaviors of your close friends, similar behaviors if they've been suspended or arrested. If your best friends have carried, again, those kind of behaviors. At the school and community level is if you feel unsafe. Are you feeling unsafe within those environments? And you may be more likely to be carrying a firearm to those environments. But again, some of these are shared, what at least in prevention science we call shared risk and protective factors. So if you see them, they are tied to a host of outcomes, whether that's firearm carrying, firearm related violent substance use, things, externalizing, internalizing, so those types of things as well. Yeah, those are a few of them. Mm-hmm.
Okay. So I guess I had a question about sexual violence. Did you find that there was more certain groups that were more prone to violence, any racial or ethnic groups that were more prone?
So this is not from our research, but from other research. We now know that the group most at risk of sexual victimization in terms of undergraduate students are members of sexual minority groups. So even more so than women. So we always thought that women were the most victimized group, but if you're gender nonconforming or you're transgender or you have a different sexual orientation than what's heteronormative, you are dramatically at increased risk of being sexually victimized on college campuses. Yeah.
You talked about, again, about interpersonal violence, but suicide was higher among rural.
Yeah.
There's clearly an association of access to firearms with suicide across the nation. Is it simply because suicide is higher?
There are a lot of factors in rural environments that sometimes mean that folks aren't getting the help that they need. And I actually think Dr. Graves can also answer this question. Whether that's access to qualified healthcare behavioral healthcare providers, the stigma potentially, and accessing assistance and accessing help. But we do see increasing rates of poor mental health, suicidal ideation within rural communities, especially within rural adolescents. I don't know if you want to add to it.
I think that also to add that death by firearm for suicide tends to be happen more often than other forms of suicide attempts, and so the rapid availability of firearms contribute to that. But it's a complex issue.
And also, you mentioned that you were working on resignation.
Mm-hmm.
Clearly,
Mm-hmm. Yes.
This question's for Dr. Weybright. I have to get my notes. What approaches might be employed to reduce the risk among rural youth, given the cultural and contextual norms, and with respect to those cultural and contextual norms? Like we don't want to say you have to stop your traditions and that sort of thing. And so, what are some possible interventions that have shown, or you might think show promise?
Well, I think there are things we can be learning from what's happening in urban environments. And so I don't think it's going to be one thing, right? Usually prevention approaches that are effective are ones that happen at multiple contextual, like you're intervening at multiple contextual levels. So at the provider level, are you checking in how firearms, are they in the home? How are they secured? Are you doing kind of mental health screening types of, to see if is someone who is vulnerable, do they also have a firearm in the home? And what do we need to do about that? Which there isn't always a great way to handle how to take someone's firearm and securely store it somewhere else, at least from an agency perspective. I'm getting mentally off track. I can share one of the things that we're doing at WSU in Extension is that we deliver mental health first aid and question, persuade, refer, so QPR and MHFA. Those types of programs aren't the solution on their own, but I think paired with a broader effort of mental health promotion, community-based organizations like Extension can be one piece of the puzzle. What we've also paired mental health first aid with is distributing firearm safes and locks. Now, firearm safes and locks also need to be kind of matched to people the way they want to secure their firearms. And so often people would like a large safe. And so how do we financially make that a little more feasible? Or what can we provide you with in the meantime to secure your firearm? So I think those are some of the pieces that come to mind that we can be learning from urban environments, but still making sure to address and respect the culture of rural environments by really taking a harm reduction approach. We understand this is a way in a part of your life. How do we just make sure people don't get hurt? And I think generally folks can agree to that, right? They don't want their children, their family, their community members to be getting injured in this process.
Go ahead, Robin, and then
I may have just missed this, but when you were talking about the sexual assault differences between on campus and off campus and the big variance there, is that data controlled for age? Because I know you said that 18 was where the highest risk was, and I know that those are the folks that largely live on campus.
Yeah, so we did control for age. So it's in addition to the age, yes.
And then the second question I had really quick was in the firearm presentation, I noticed when you talked about the categories of risk factors, that policy wasn't part of it. I was just curious if that was just separate research, or as I'm looking at like Florida and what's happening with that, I'd be curious what your thoughts were about the role of policy.
I think policy is a separate piece. So in that, the recommendations that were provided, a lot of them address the policy level. So I think in policy is, I would say, a newer area to me. And as I've kind of evolved in my career, it's a greater realization that I need to be, that needs to be a goal of my work as well. So I think fortunately or unfortunately, the way the academic system is as you become, moving from assistant to associate professor, there's a push to produce research. And now that I can say, okay, I have produced some research, but now I want to make sure it has as large of an impact as possible. And how can we do that? We can do that by talking with folks, distributing the findings, but we can do that by informing policy. And so that is not an area in which we've touched on within the current project, but I have within other projects that I've done with youth participatory action research, where we've had policy impacts at a local level, as well as in working with some of our state partners. I think in the interim of policy, that's where some of these community-based approaches can be helpful and kind of in the meantime. But that's the ultimate goal, right? Is to impact policy.
Hi, thank you. My question is related to the firearms topic, but just curious, in interviewing and doing focus groups with youth and working in other projects you have with youth, I think sometimes that topic, and some of them mention that they get their firearms passed down from their parents and the access maybe within the household. Did you meet any, resistance from parents allowing students to be enrolled or their kids to be enrolled, or anything that you felt that the youth were sharing as far as they wish their parents were doing? I'm speaking, my opinion's coming out, but that maybe they wish their parents were doing something differently, or that the access wasn't so easy that they understand it. But just anything that when you do have to target an intervention for youth, that parent piece is a big piece, and how do you address that? Like the culture among the adults around the youth is also part of it.
Yeah, and that was a critical piece because we're talking to minors. So we need the parents' consent. We spent a whole year planning for focus groups and interviews, which sounds a little indulgent, and I don't usually get to do that, but it's because it can be such a controversial topic and very sensitive topic. There were parents who were never going to let us talk to their kid, despite their, so I went to in Spokane, it wasn't that same picture that I showed, but I went to a horse camp at the Spokane Fairgrounds just to chat with parents, to chat with youth, just to feel them out and say, hey, if we ask you this kind of question, what would you say? I talked with some parents, some who wanted nothing to do with me and didn't want to talk with me. And we knew that would happen, that there would be a group. This is despite having a local person. We had our local 4-H folks there. So I'm kind of using some of their connections and the credibility that they've built up in extension with these families to try to have a connection. I had also involved in the project is the person that leads our WSU 4-H shooting sports program. And she reached out to families and one person was like, no, you're not going to talk to my kids about this. Absolutely not. And she was surprised. I mean, she is a firearm owner. She is into this culture. She lives in the community. She works with these individuals and knows them, but it didn't matter. When I talked with youth, they were fine. They're fine talking to me. We actually had this wasn't a focus group there. Again, it was just a discussion. We had a conversation where one youth said, well, I don't think you should be carrying because of this. And another youth said, well, I think you should be able to carry because of this. And it was a very respectful conversation among a bunch of teenagers. So it wasn't the youth I was worried about, it was the parents. So yes, we knew there were people who weren't going to want to chat with us. So there are voices missing from this of folks who, one parent said, this is a political topic, whether you want it to be or not. That's just how it is by nature. I do think, as far as things that youth may have said for parents, I didn't hear that come out, but we didn't ask for it. So I want to be honest about that. Youth generally, again, we're still looking at the themes that are emerging from the qualitative data, but generally feel that we need to be safe and respectful around firearms. We did have a small percentage and number of individuals who did say they carried a firearm to school within the past month or within the past year within the sample. So we do know that some of these behaviors are occurring within the youth that we talk to. So we feel like they're being honest and direct with us. But yeah, it's sometimes in these sensitive topics, it can be interesting, the conversations and how comfortable different people feel or not. We also did interviews, and I think that may have been a better format for sharing for some youth than a group setting. So.
That's a good point. I might have missed it in the presentation, but with the access point, was the majority of access from within the household, or?
Yes.
Yeah.
Okay, well, please join me in thanking our presenters and